Now to a serious subject we all need to be aware of. Think of 6 men in your life, okay? Now imagine that one of them will be diagnosed with prostate cancer.
Which just seems like an incredibly high statistic. So now our partners at Spectrum Health Medical Group are offering you an opportunity to learn more about the disease with an upcoming online chat.
Dr. Brian Lane is a urologist with the medical group, and he's here today to talk about the numbers, what you need to know, and about some research that you're doing. That 1 in 6, it surprises me. I mean, it's an alarming statistic.
Prostate cancer is the most common form of cancer in men in this country, and it's a big number. I mean, this really means that, you know, we all know somebody who either has or will get prostate cancer, and so it's something we need to be aware about and do something about.
So very, very common. You talk about some of the statistics. Go ahead and lay them out there for us. How many people are affected? What is the cure rate here? What are some of the numbers we need to know?
Well, again, the downside is that 217,000 men approximately every year will be diagnosed. The good side is that most men are cured. And we have excellent treatment options. And the two things that lead to that, one is catching it early, and then two, doing something about it and getting it treated. Sometimes we can hold off on treatment immediately and treat several years down the road, but again, the key is now. The key is to catch it as early as possible, and that'll prevent problems down the road.
I know that getting that exam is extremely important and something that, you know, men don't always look forward to. I'm married, I know this. But are there symptoms that can happen, or do you most likely detect problems when you're in there actually for the exam?
So years ago, men had problems, and that's how we found out about the prostate cancer. Because of the screening exam and because of the PSA blood test, we can catch this cancer before you have symptoms. So most commonly, men don't have symptoms when we catch it, but if you do have urinary symptoms, for sure, you need to come in and see your physician, because there's ways we can help with the symptoms, and certainly we want to rule out that there's any cancer there.
And obviously catching things early, so this is something that can be done when you just go in for a yearly physical. Right.
So I'm a urologist, I'm a specialist in this area, but the way the screening is done is with your primary care physician. And so you just go to the doctor, make sure you don't have high blood pressure. I mean, this is Men's Health Week. We need to make sure all the things are checking out, and having the screening test, which includes a PSA blood test, and then also the digital exam, which again is not everybody's favorite aspect of it, but something that's important.
And it's very quick.
And it's very quick.
Well, there's so many different things, you know, it is really changing. You said it's almost, it's really nice to hear that so many men do recover from this, because it sounds so common, and that they're really, the chance of dying from prostate cancer is very minimal.
It's very minimal. And so most of the education I do with patients when they get a cancer diagnosis is to say, okay, this is cancer, but in most cases it's cancer with a little c, not with a capital C, and to say, you know, this is something that obviously is going to cause stress and anxiety, both for the man and all of his loved ones, but then how do we deal with it, and how do we deal with it appropriately? And most commonly, we'll get a cure.
And obviously the earlier the better.
Absolutely.
Okay.
Absolutely.
All right, and now talking about all this information, of course there's a lot to know, a lot that some people may not know even about their own bodies. You're going to do an online chat coming up. Can you tell us when that is, and tell us about it? Like, what are some of the questions you anticipate being asked?
Well, I'm looking forward to the opportunity. There's a lot of information out there about prostate cancer, controversy about when you should start screening, how often you should be screened, all the different treatment options. And so this is really the opportunity for anyone in an anonymous fashion to get their questions answered. And so it'll be next Monday at noon at the lunch hour. And again, the goal would be bring your question, and I'll answer it to the best of my ability for you, and help to direct you in other resources that can help if I can't answer it all at that moment.
You know, you had mentioned, you know, there is some confusion sometimes. Is there a certain age that men should know, when I hit this mark, I should just go in and have this as one of my regular yearly checks?
Right. So traditionally it's always been 50 years of age. The American Urologic Association now feels that 40 is a better age to start screening. We actually are privileged in this community to have a research study that we're just starting for men in their 40s to begin the process of getting screened, and actually to get a genetic test done where they would really understand and know their personal risk of prostate cancer, and that could really set them up moving forward about how often they would really need to get screened. So we're really excited to be able to offer this to men in the community, and looking forward to having all the guys sign up who are willing to participate.
Awesome.
Okay. And you mentioned that genetics. How common is that? How much does that increase your chance?
So we've always known that a family history of prostate cancer increases your risk of developing prostate cancer. So a man who has a father or a grandfather or a couple uncles that have prostate cancer is at higher risk. But there's also genes that each of us has that either raise or lower our chance of developing not only this type of cancer but other types of cancer. And all the research in cancer these days is starting to give us that information. Prostate happens to be near the forefront for that, again, because it's so common. And so it's a good one to check, and I think we're going to do better for our patients moving forward by being even more specific about your risk.
Well, Dr. Lane, thank you so much for coming in today. And of course, one more reminder, next Monday at noon, Dr. Lane's going to be online for you to talk to. Complete privacy. If people have any question, no holds barred, right?
No holds barred.
Yeah.
No holds barred.
That anonymous factor is a nice one.
Absolutely. Absolutely.
Yeah. Well, thank you.
Thank you.
We'll be right back.